Welcome to my podcast. Today I'm going to talk about warfarin. So basically, a patient might come to you complaining of leg pain or had a history of DVT recently and is about to be discharged and given warfarin. So you need to go to the patient after introduce yourself, asking the patient name and date of birth and address. You will ask, how can I help you today and what brought you to the hospital? So the patient will tell you, I had a history of blood clot or calf pain or any sort of blockage, and he's about to be discharged. So you will take just a brief history about the whole thing, how it started, and how he's feeling now. So the patient will tell you, I was in too much pain, I'm feeling much better now as I've been treated. So you'll just take a brief history about any previous medical history, any current medication, any other diseases like, for instance, liver disease, high blood pressure, if there is any blood disease or disorders, if the patient is taking any over-the-counter medication by himself, any known allergy. Also, you have to ask about lifestyle questions, which is if the patient is a smoker, if he drinks alcohol, what's his diet like, any physical activity, and if there is any history of calf pain before or it's the first time, and what he was doing when he devolved with that. And then you will brief the patient and tell him, do you know what it means, DVT? So you'll say in simple terms, it's basically when the blood gets thickened and solidified to the way that it blocks the blood vessel or the tubes which carry the blood to the tissue needed. By that, we will give you something called blood thinner, which is called warfarin. This will make your blood thin and will minimize the risk of clotting. So I need to tell that this tablet shouldn't be taken with cranberry and should be taken with full glass of water and should be every day and the same day and mostly in the afternoon. And you will tell that this tablet should be taken at least for 6 months, 3 to 6 months, and you will instruct the patient that if he notices, and you will give first a leaflet to explain about this medication, and you will tell the patient that he had to have a large card whereby it stated that he's in blood thinner, and always to inform any healthcare professional or any emergency or any dentist that he's taking blood thinner. And always he needs to have a regular blood check for his INR. So this is something the patient should be drawn his attention to. And you need to, of course, explain to the patient some general advices, say, for instance, the side effect of warfarin. The most important one is bleeding. So if he notices any bleeding from any orifices of his body, like for instance from the mouth, from the nostril, from the back passage, from the water passage, all of that should be noticed. If he had any unusual headache as well, this could point out to subarachnoid hemorrhage. Tell the patient to avoid any excessive or vigorous sport whereby there is contact. So this could lead to bruises and bleeding. Another side effect expected is nausea, vomiting, diarrhea. And also explain to the patient if he missed, for instance, one dose or took the wrong dose, he should take the normal dose the next day, not to increase the dose by himself, and should seek the help of his GP order warfarin clinic if he's in doubt, or also ask the pharmacist. Apart from that, he should avoid any vigorous or contact sport, drink in moderation regards to alcohol, and the dose to be started with is 5 milligram, and to be monitored, as I say, by checking the INR, because sometimes the INR might go very high. In that condition, we need to stop it for a few days until it becomes to normal. If the patient, for instance, has any cut injury, instruct them to apply firm pressure until it stops, and if the blood did not clot, he should seek emergency measures by calling the hospital 999. By that, I hope that I covered the main points about warfarin, as it's considered as a counseling case. And I hope to see you in another podcast. Thank you.